November is National Alzheimer's Disease Awareness Month. Just to put this in perspective, more than 6 million Americans 65 and older are living with the disease.
By 2050, that number is projected to reach nearly 13 million.
So this morning, we're actually going to spend some time talking about what we can do to protect our brain health.
Today's special anchor Maria Shriver and Dr. Laura Baker, a neuroscientist at Wake Forest University School of Medicine and lead co-principal investigator of the U.S. Pointer Study, the largest clinical trial for the prevention of Alzheimer's in the world. Join us now. Good to see you.
Good morning.
Thanks for being here. Okay, so Maria, where are we right now at the point of, if it's possible, to prevent Alzheimer's?
Well, the idea that we're even talking about prevention and Alzheimer's in the same breath is super exciting. When I got involved in this 20 years ago, nobody spoke about prevention. Now we know a lot about a brain-healthy lifestyle, as Dr. Baker will talk to you about what she's actually studied and what she's finding out. But we're talking about prevention in terms of talking about sleep, talking about exercise, talking about managing stress, talking about what you eat, how you socially connect, how you keep your brain growing and learning and evolving. These parts of the discussion weren't even in the discussion 5-10 years ago.
And going off of that point, mentioning some of the specifics, how much exercise are we talking? What sort of nutrition? I mean, Alzheimer's does tend to run in my family, so I know my mom is very concerned. What can you tell her to do right now?
Well, the most important thing is everybody should be concerned, not just people for whom it's in their family. Anybody with a brain should be heeding this message, right? Because it's everybody's job to try to keep their brain as healthy as possible. So Dr. Baker has just done a big study about the role of exercise, and I think which is really exciting that what you learned is that it's exercise. It doesn't have to be HIIT exercise. It doesn't have to be highly intensive. It can just be get up and move, because people have a sedentary lifestyle. Managing stress, really important.
Dr. Baker, I'm really interested because, as Dylan said, for those of us who, even if you don't have Alzheimer's, you know someone. I'm 44, more parents of my friends' parents than I can count. So what does the science or research say behind what we can do to try to at least early detect or prevent? Like, what can we be doing?
Those are really good questions. So we just finished a study not too long ago, trying to answer that question, especially as it relates to lifestyle, a brain-healthy lifestyle. And in our study, we included about 300 older adults with mild cognitive impairment. Now, mild cognitive impairment, you can think of this as the gray zone between cognitively normal, what we're all experiencing as we get older, and dementia. So these people don't have dementia, have mild cognitive impairment, but in a one-year time, they all have significant decline in their memory and thinking. So these are the people that we really want to target because they're at high risk.
Yes.
So in our study, they assigned to either a low-intensity or a high-intensity exercise group. The high intensity is more aerobic, the low intensity is more stretching balance. And they were exercising at a YMCA under the supervision of a YMCA trainer 3 to 4 times a week for a year.
Okay.
What we found is this. Neither group declined over time.
Really?
And this was a shock to us because these people should have declined. So our take home, which is I'm very excited about it because it has much more application. More people can do any kind of exercise. So our take home is any type of regular is a key word, regular supported exercise. These folks can't exercise on their own. They need help in the way that we all do, but these folks particularly need help for the accountability. But regular supervised exercise for 12 months can protect against decline for these individuals.
Dr. Baker, what has your research shown you so far about actually improving cognition in older adults?
We all want to know that, don't we?
Yes.
We're all waiting on the edge of the chair asking what we can do. So one of our other studies I'm very excited about, too, is we were looking at a daily multivitamin.
That's it.
Really exciting.
Daily multivitamin. For 3 years, it was 2,000 people in our study. We gave them either a multivitamin or a placebo. You can't tell by looking at it. So that's really important for clinical trials, that everything is tested in a clinical trial. So we gave 2,000 people a multivitamin or a placebo for 3 years. The active multivitamin improved cognition in those who received the active multivitamin.
Measurably? I mean, it was...
Measurably.
This is super big news.
Yeah.
Super exciting. Both of these things are, because they are things people can do today after the show. They can start taking a vitamin. They can take a walk around the clock. They can prioritize their sleep. They can think about eliminating or at least decreasing sugar in their diet, which plays with brain health. They can figure out ways to be socially connected. That's a big thing. So this is an exciting space. I think so much of the Alzheimer's caregiving discussion goes about what we don't know or we don't have a cure, but we know so much more now about how to empower individuals than we did 2, 3, 4 years ago.
This is really exciting.
Wow.
Maria and Doctor, we got to go, but if they want to find more, people want to find out more about this, where would they go?
Well, they can go to today.com. They can go to the Women's Alzheimer's Movement. We have guides there that you can download, which tell you how to talk to your doctor, what you need to know if you're a caregiver. They can talk to you about getting support for the caregiver before the caregiver is really incapacitated, which happens to millions and millions of people.
That website's right on the screen right now, right beneath Maria, today.com/health.
This is so important.
And Maria, I think it's really important that people, that the families, if you notice that even the slightest change, to talk about it.
Yeah.
Don't wait till it's too late to have
Especially
the
coming up to the
difficult
holidays.
conversations.
Right.
People are going to see each other for the first
Go to the
time.
doctor. Go to the doctor.
Fantastic conversation.
Thank you.
So neat.
Thank you
both.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.